Hello, Dr. Minkoff.
Morning, Michelle.
I'd like to talk today about Rocky Mountain spotted fever treatment. Can you describe what is Rocky Mountain spotted fever?
Sure. In my past, I was an infectious disease doctor in California, and we actually did see Rocky Mountain spotted fever occasionally. This is an illness that's carried by a small bacteria called Rickettsia rickettsii. It is an organism that can't live on its own. It's parasitic. It has to live in a host inside the cells of a mammal. Humans aren't the usual vector for it. It's usually rats or mice or other animals in the wild, but sometimes it can be passed to humans. It is transferred by a tick bite, classically, so that you get bit by the tick. The tick has a mouthful of these organisms. They get into our bloodstream, and they can cause an acute illness which looks like flu with a rash. Sometimes nausea, vomiting, sometimes people are very sick, sometimes there's high fever. It was originally described in the Rocky Mountain area, but this is a worldwide disease now. So the acute treatment of it would be an antibiotic, usually doxycycline, where someone would then get over it and get better. What we're seeing today is not so much Rocky Mountain spotted fever as itself, is that we're seeing Rocky Mountain spotted fever as a part of what we call Lyme disease. So Lyme disease is kind of a big wastebasket where the tick that bit you, or the mosquito, or whatever it was that bit you, didn't just have one of the Lyme bugs in his mouth. He might have had 4 or 5 or 6 different things in his mouth, and he gave you some of them or all of them. And Rocky Mountain spotted fever, this Rickettsia rickettsii, could be one of those organisms. So when we test people, we look for this. We look for antibody, or using DNA PCR technology, we look for these things to see if that's what the person got infected with at the same time. Generally, our treatments cover this along with the other Lyme organisms, so I'm not doing something specific just for that. But it usually gets better along with the rest of it. So if you think you have Lyme or Rocky Mountain spotted fever, or this is something that you're concerned about, go to our website. It's lifeworkswellnesscenter.com. There's a lot of information on Lyme and associated infections where you could get information, and we really may be able to help you because we're good at this.
Thank you.